Hello, welcome to this webinar of the Jindal School of Government and Public Policy. The theme we want to talk about now in this webinar is how public policy can help tackle what we call urgent and important problems. The reason these two adjectives are being used, urgent and important, is because we in fact can classify many challenges and problems into these categories. It's either urgent and important, or something could be urgent but not important, and something could be very important but not so urgent. And it's said in the literature that Dwight Eisenhower was a general before he became the president of the United States, had this metrics about what he should do as a policymaker, and he classified actions that he had to take or areas that he had to take as urgent and important, urgent but not so important, important and not urgent. And so he had these four categories, and it was a way of helping him prioritize time. And very often what we do is we attend to things that seem to be urgent. Like if this webinar is being broadcast at 1, that's urgent. I mean, you have to come on this webinar at 1 o'clock. But there may be more other important things that you have to set aside to be able to do that. Very often, most of the time, policymakers, particularly those in public life, tend to act in the short run into something that's immediate and what seems to be urgent at that time, and in the process maybe neglecting something very important. And now we have in a situation where we have the threat of the, not just the threat, the actual infection of a very, very virulent and contagious virus, which is capable of affecting every single human being if we don't do anything about it. And so obviously that's a very, very urgent issue. But once you decide, okay, we will tackle this urgent issue, there are certain important issues that also need to be tackled. And one of the lessons in this process till now is what are the important things that we've neglected to tackle. And just to give you an idea of why public policy is important all along, is that we as a country have neglected public health and the investments that are needed in public health. We've also neglected education. And now you can see the difference that investment in these two areas can make already. You can see it in the case of Kerala. Now, Kerala is a state which responded first to the warning that there is a virus that is about to spread out of China. Kerala's government took action screening people at the international airport. Kerala has a very large number of people from Kerala working abroad, so they were very, very concerned about that. Kerala has 94% literacy in the country. So communicating messages related to health and getting the people to understand them became a lot more easier in Kerala. And Kerala has also invested much more in terms of access to health. There are more public health facilities within walking distance for people in Kerala. They may not be very sophisticated, top-class hospitals, but nonetheless, medical care with qualified professionals being able to look at people. Kerala has made a long-term investment in that. Now, all of these, the fact that Kerala, public policy in Kerala attended to important things in the past compared to other states, we can see the consequences of it now because that's the only state in a way that's on top of it. Other states will eventually be, we hope. So I want you to appreciate this distinction between important things, which generally seem to be things that can wait because they are not urgent in that sense. But nonetheless, if you don't pay attention to important things, when something very urgent like this virus challenge comes along, you find yourself, short-footed because you've not paid attention to the important things. So this distinction between urgent and important is important to remember. It's something we have to do every day in our daily lives. We tend to procrastinate. We don't wish to do the things which are important to do because that can wait a little longer. We always find something that, somebody has called up, some visitor has come, some email that has to be responded to immediately. All of these temptations we have. Public policy makers also have the same sorts of temptations, especially in the realm of public policy, because politicians have got a pulse on what's going on and want to react immediately to what people may think. And they also believe that the public has a very short memory, and therefore they must act on things that public thinks important now. So this particular context of the coronavirus, the disease called COVID-19, is a context in which the importance of what is both urgent and important come to the fore. And while you may be able to tackle some things with some urgency, and in fact you have to, because it is urgent and immediate, there's also some things that are important that you cannot overlook. And so we have a fantastic panel to discuss these things and to illuminate how public policy plays a role in making these decisions for the well-being of people. Public policy is really something which has a goal. The goal of all public policy is to improve human well-being and human welfare. And the way public policies attempt to do that is by getting some changes in behavior from people and institutions and organizations doing things a little differently from what they used to do in order to get some more efficient and effective outcomes. There's also a difference between efficient and effective that we may wish to discuss at a later stage. So we've got three public health specialists who are also specialists in public policy and teach the faculty of the General School of Governance and Public Policy. So I'd like to invite them one by one to join in this discussion after this brief introduction. Pradeep Gwen is someone who's been trained in public policy, is a public health specialist. He specializes in that, but that means he has depth in a particular area, but also a great deal of range. And the same thing goes for my other colleagues. Vivek Padvetnia is actually a medical doctor. Who better now than someone with knowledge as a professional medical practitioner who is into public policy and subjects like health economics. And we also have Indranil Mukhopadhyay, who is again specialized in public health, but has a great range, is very, very sensitive and knowledgeable about political factors and economic factors that have a bearing on public policy decisions that have been made, need to be made, and all of them have excellent lessons to draw upon from their knowledge of history and what's gone on before in this country. And they're also futurologists in a sense, because I'd invite them to look to the future to see what the world looks like for India, as well as the world after this epidemic is over. It will be, it may never disappear completely, but it's not likely to be as virulent as it is. That's in the nature of how viruses behave. So let me hand over to Pradeep.
Thank you. Just a small bit. So that was our Dean Sudarshan Ramaswamy who was speaking, who opened the floor. I am Pradeep Gwin. I have a PhD in public policy from the University of Maryland in Baltimore County, and I've had almost 10 plus years of research experience in research institutes in India and the US, including the erstwhile Planning Commission in their perspective planning division. I typically teach courses in public policy to the master's students and some undergrad courses to our BA economics students. What I'm going to talk about in general is what public policy is about, what this course is about, and how this course is slightly different compared to the conventional courses like masters in economics, sociology, political science, so on and so forth. So as Dean Sudarshan mentioned, what public policy is about is to try to bring in a behavioral change among the public through certain set of policies. Now, these policies are going to be created in the space that we are in, and we always have to understand that we have limited resources that we have to kind of prioritize. As Dean Sudarshan mentioned, that there is something which is important, there is something which is urgent. So we have to always kind of make this distinction between how can we prioritize our resource allocation. So what public policy typically does is it holistically tries to understand a problem which is affecting a larger group of people, which is the public. And in trying to understand the problem, what public policy does is it takes into consideration factors from different aspects or domains that we talk about. We think about how an economic, whether or not there is an economic aspect to that policy problem or that problem that is affecting a larger group of people, whether there is a sociological aspect, whether there is a demographical aspect, whether there is a political aspect, whether there are several other dimensions, including health, for example, in the present context, of course. So what this whole science or art does is it tries to kind of help you understand a particular problem from these different dimensions, which typically other graduates fail to kind of inculcate immediately after their graduation. So you will be able to understand or look into a particular problem from different lenses. You will be able to understand how these different lenses are important, how you can use different data sets, data sources. We have excellent faculty who talks about using different kind of data sets, integrating data to your analysis to come up with sound policy. Now, these sound policies, what we talk about, needs to be effective, efficient, and so on. So the whole idea about this course is to help you prepare, to enable you understand how you can deal with a certain problem that is affecting a larger group of people in terms of looking into different dimensions of that problem. We can think about certain policies, how these policies are effective, and Vivek, my colleague, can talk a little bit more about that. Vivek, to you.
Yeah, thank you very much, Pradeep. I think that gave a very good introduction of what this course is about. I think moving on, one easy way to understand what public policy is, whatever the government does or does not do is public policy. Okay, and if you look at public policy, as Pradeep was saying, are aimed at, or the government's response to issues the society or the citizenry is facing, then these issues can be of different kinds. As our Dean Sudarshan said earlier, it can fall into the four quadrants. So how does a government's response to a particular issue should be? So that depends upon several characteristics of the issue that we are addressing, a social issue that we are concerned with. The first of this is that, for example, if it is emergency or if it is very urgent, then the first question which comes to the mind is that, is there a precedence of this emergency or urgent issue so that we can look at the hindsight of what has worked in that and can be employed here? Or is it something very new as this COVID pandemic is? The nearest precedence that we can draw is 1918 Spanish flu. The second question also that we need to look into it is that how emergent the situation is. So by delaying the government's action, or let's say government's policy response to the social issue that we have by a day or a week or a month, what are the implications that delay in decision has, or delay in policy response that the government has? The third aspect that we need to look into is that whatever the policy that the government may initiate towards addressing that particular social issue, for example, let's say in this case, the COVID pandemic, how coercive the policy is going to be on the citizens. to what extent the citizens need to participate in that policy to make it very successful or to make the policy very effective. So one example I can give is that, for example, let's say if you conduct our once in 10 years exercise or census, every citizen is expected to participate in that, right? So similarly, if you look into COVID pandemic and if the government is initiating a host of policy measures, how coercive it is on the part of the citizens to participate in those measures or in those policy initiatives for the policy to be successful. So one example that we have is the so-called social distancing or the lockdown which is in force. The fourth aspect which determines a government's response to such emergency situations is how intensive it is on the administrative machinery of the government. So if the intensivity on the part of the administrative machinery of the government is very high, then we need to have a very high bureaucratic capacity to administer and implement those policies. For example, let's say if you have to conduct, again, if you go back to the earlier example of censuses, it's a nationwide exercises, and the government's entire government machinery will put into force in making that exercise successful. For example, let us say if you come to the COVID pandemic that we have, and some of the measures that the government has taken, be it economic or be it social, like safe distancing, how intensive it is on the bureaucratic capacity of the government, or how intensive it is on the government machinery of the government in terms of executing it, in terms of implementing it. So I think these four dimensions, if I may repeat, is a precedence to this crisis, number one. And number two is that how emergency the situation is. Number three is that how coercive it is on the part of the citizens to participate in this policy initiative. And number four is how intensive it is on the administrative machinery. So these four dimensions determine to what extent the government policy or the government's policy initiative or policy response to the situation that we have will be effective. Okay. So, and if you look into it slightly more in depth, if you look at, for example, the present pandemic that is involving all of us, it's a public health issue. So public health as a social issue or slightly differs from other social issues, which could be important and which could be emergency also. So how should the government's approach should be towards tackling such public health issues which are very emergency in nature, which involves the entire country, which requires citizens to participate and which requires the entire government machinery to participate? I think I would love to invite my colleague Indranil to elaborate on that.
Thanks, Vivek, for setting. Shall I? Thanks,
Yes,
Vivek, for setting out the context. In the master's program on public policy, we have a specialization of health policy. And in that health policy specialization, all three of us teach various courses. But one of the things which we are trying to inculcate through the courses that we teach is something called a public health approach in understanding health situations of people. And when I say public health approach, I'll try to illustrate it in few minutes from now. There are few things which are crucial. One of the things is which is crucial is to understand health as a holistic problem, in the sense that the different aspects of our lives, people's life, that are in turn govern, in turn shape our health outcomes. And I'll illustrate with an example. In this context of COVID, you may know that some of the public hospitals and also few private hospitals have been converted into COVID hospitals, which are specifically dealing with patients of COVID. And also you might be hearing from newspapers that there are zones in various cities and various parts of the country which has been called hotspot. Hotspot means there are many cases coming from these particular areas in the in that city or in that locality. So how would a public policy person, a person with public health specialization or health policy specialization would like to see the various issues of health? So I'll illustrate through a case study. In the Delhi, which in the city of Delhi, which is close to our university, our capital city, has various such hotspots identified. identified. And one of these hotspots are the West Nizamuddin, because there are various cases in that hotspot. And what has happened is administration has now kind of isolated these people residing in these places so that the virus do not spread. Okay, and of course, COVID is an important and also urgent problem. But then there are several other health issues that people at this moment are facing. So one of the issue is the issue of non-institutional deliveries or childbirth. So I'll illustrate with the story of a lady whose name is Malati. We have changed the name for some to de-identify this. So Malati had a incoming labor, and she went to a private clinic nearby to see that her delivery is arranged urgently. Now the private hospital didn't have enough facility for delivery, so she gets referred to another better, well-functioning, bigger private hospital. Malati is a wage laborer. She works in the households as a domestic help. So when she reached that better private hospital, they asked her to submit something around 1 lakh rupees for the delivery. It was unaffordable for Malati. So what Malati does is to now go to a public hospital, which is one of the biggest medical college hospitals. And here Malati is asked where is she from, and she says that I'm from West Nizamuddin place. And as you know, that place is a red alert zone for COVID cases. So that public hospital, which is a general hospital, cannot treat that patient because she could be spreading the disease to other people who are hospitalized there in that hospital. So what happens? They send her to another hospital in the public facility, which is designated for COVID patients. When Malati reaches there, that hospital actually does some tests and finds that she is not a COVID patient. So, and that hospital has so many COVID patients. So they don't want Malati to get herself contracted to the disease and get herself more vulnerable. So what they do is refuse her. And by the time all this process has happened and Malati has gone to 4th hospital, her labor pain has really set in, and it is very late at night. So what does Malati do? While she was walking back from the hospital, one kind-hearted gentleman who had a vehicle, who was transporting patients in this emergency situation, takes her back home and then arranges a alternative public hospital for her to deliver her child. Why I brought this story? It's extremely important that we understand various aspects of human lives to understand public health problems. What we need to also in this crisis understand that people are at various strata in the society with various purchasing power. Some are working as daily laborers. Their life would be differently affected by compared to those who have a regularly paid job. So what becomes a crucial aspect of people's health? But also we have a health system who are, when people fall ill or when people need care, to cater to various needs of people while addressing an emergency. And if we don't have a pro-people approach, many people who need various kinds of care might be excluded from the care they need. So at this point, what is important and what the health policy program also does is to help you understand what are the various dimensions of health, how gender becomes a crucial stratifier for health or crucial in shaping health challenges of people, how health system has to come and work in contact with each other. So there are a few principles I would like to highlight while talking about the public health approach, and then I'll stop it. One of the thing is that public health talks about comprehensiveness, the various facets of human health and life that we need to be sensitive about. It involves from water, sanitation to scientific research and medical technology. The other aspect is about interconnectedness, how these the livelihood and health issues are connected needs to be understood better. But also at the center of this is the people, the various kinds of people, the inequities that shape their lives, and how public policy or health policy can respond to this. But I would like to now, our common perception regarding health is it is about the medical doctors and the medicines and the technologies, the diagnostic tests. But what about, why do we talk about various social determinants of health? I'll ask the medical doctor in our panel, Vivek, to illustrate on this. Why, Vivek, why do we talk about so many aspects while dealing with health issues of people? Thanks.
Thank you, Indranil. I think that's just a scenario in understanding the challenges of public health very well. And if I may briefly elaborate on this, one way we can understand the public health challenges is that how healthy I am depends upon how healthy my community is. That sort of summarizes what Indranil was elaborating on. And at the same time, for example, let us say in the case study that he was talking about, Malti, one is, suppose, let's say, if the Malti has to be addressed, if a condition has to be cured, there are two aspects to it. One is very clinical aspect. Can she go to a hospital, and does the hospital have the enough the kind of health workers that are required to attend to her case, and does it provide the kind of services that are required? Now, for example, let's say if you go to a primary health center, which is one of the lower level health centers in the government public health system, and if the pregnant woman goes there, and if the doctor is there, but doctor says, look, I cannot take you because today my water is not running. Okay? So that is one aspect of able to cure a patient or able to treat a patient based on the clinical aspect. But for that to happen, a lot more factors which are located in the broader society or the context in which we live in is very important. Suppose if I give you an example from one of my earlier experiences of having worked at such grassroots level is that, so many a time when people are in urgent need of, let us say, a doctor's attention, the transport, which is very much required to take them from their house to the health center, be it run by the government or be it run by the private, are not easily available, even in urban area. And if you go to a rural area, it becomes even worse. For example, even though WHO says that the average distance for accessing a health center should be less than 1 kilometer, in our case, it ranges very widely and can be even up to 5 kilometers. Now imagine a rural area in which a household is having a kind of delivery situation that Indranil was explaining, and the nearest hospital is about 5 kilometers away, and there are no transport which is available. Even though the hospital may have a very well-equipped physician, nurses, and the entire setup required to deliver a patient, the patient won't be able to reach the hospital just because the fact that there is no transport which is available. So the various social determinants or the various social contexts in which we live and in which we grow shapes to what extent the health services which are available are actually accessible to us. When I say accessible, I mean it along several dimensions. See, one aspect of looking at access or barriers to access a healthcare service, as Indranil was saying, cost. If I'm a person from a rural area and if I go to a hospital for delivery and upfront they demand 100,000 rupees from me, I will not be able to pay. So cost is an important aspect of affordability. The other aspect of affordability which I was just describing was the distance. The higher the distance from the nearest health center, lesser would be the accessibility of that particular health center, even though excellent services might be available. The third could be acceptability. So to what extent the perceived quality of the services given in a health center, especially in a public health center, is acceptable to the people. So if you look into the general perception that we have amongst us, the quality of the services that we get in a government hospital may not match with the quality that one may get in a private hospital. But this is subject, this is very highly contentious. Because what is quality as perceived by people or lay people will be different than what is quality as perceived by the doctors. Right? And lastly is that from an acceptability point of view is that given that our country is socially very diverse, for example, let us say if I can give another instance from my earlier experience of working in a rural area. So after finishing my medicine, we went and started a clinic in a very remote forested area to provide free medical services to the people. And we were very young doctors and we were very idealistic. And one day we got a call saying that a woman is delivering, so you please come. So we were very happy that we could be of some use. So we boarded on, we had a bicycle. We rode on the bicycle and went to the house. But to our utter surprise, we were not allowed to enter the house. We were asked to sit outside. And then when the baby was handled by a local person, and when the baby was born, all that we could do was apply some antiseptic to the umbilical cord and get out. So why the services of a trained physician was not acceptable to the people when the service was available at their doorstep? So these are the various challenges that we discuss in our courses related to health policy, and health economics, and how should be the policy response to overcome these challenges, which are both social as well as clinical.
Okay. Well, no, let me just add a footnote to what you said. I liked very much what you described, Vivek, particularly the point about facilities, the interconnectedness of facilities, and acceptability. So one point I wish to emphasize to prospective students of policy is that in India, this is a new discipline, and it's a discipline that draws on the insights of a number of fields. It draws on insights from politics, from economics, from sociology, and from culture. And your last point about acceptability means that in order for public policies to work, you must have a good idea of what is in fact the culture and the values of people, the ways by which they live, what's acceptable to them, what's not acceptable to them. Now this element, if you do a narrow discipline of say just economics or just medicine as you had done, and not enough sociology and anthropology, you would land up at somebody's doorstep and not be allowed to enter. So a public policy maker has to draw insights from a number of disciplines. And for a long time, we thought, oh, people in government can deal with this. But I think the realization has now grown, just as it used to be said that war is too important to be left to generals alone. Public policy is too important to be left only to public servants and policymakers within the government. We need a lot more people to be more knowledgeable about public policy, because policy depends on intelligent feedback. Once the policy is put out, we need people who can appraise and assess the efficacy of that policy. They need not be in government. In fact, it's preferable that they are not in government, because if they are in government, they'll have a vested interest to imagine or pretend that everything is working very well. But if more people outside government are knowledgeable about public policy, they can be more critical, they can evaluate objectively, use good techniques and skills to appraise the efficacy of a project, to find out if it's achieved its results, and provide that feedback. Now that feedback to government, to change the policy, to adapt it, to adjust it, depends on what people outside the government can do. And a lot of people outside the government need to be more knowledgeable about public policy than is the case presently in this country. So what I'm trying to emphasize here is there's a very large unmet need for people who are knowledgeable about public policy. And the idea that public policy is something we can only leave to those in government and others don't have to care about it is completely wrong. And we would be a better governed, well-managed society if there were more people with an understanding of public policy, with insights drawn from different disciplines. It doesn't matter if they are in government, then they will be a very valuable asset to government. And therefore, those who are aspiring to join the government by doing the civil service exam, if they have a prior training in public policy, they already come equipped to doing what they ought to be doing when they are in government. And the government will make them wait for a long time before they allow them to come into the policy making thing, because of our emphasis on seniority. Now that's again a policy question. Should you leave policy making only to those who get gray hair, or can you get young dynamic people to be involved in policy making? That's a policy decision for the Department of personnel and training and the Home Ministry to make. Nonetheless, those aspiring to join government will do very well by either joining a BA Social Science and Policy program or by doing the MA in Public Policy program, because both programs are designed in such a way that they draw insights from a number of disciplines, and particularly a discipline which is generally neglected, which is culture and sociology. And I'd also say that we have a lot of emphasis on ethics, because in the end, are we doing the right thing? How do we do good to people? I mean, there are very serious ethical questions. Now, we in fact have an ethical question right now as we are speaking. We are protecting a large number of people from getting infected and the risk of maybe dying of this virus. But the method we've chosen to do it is that we've closed down the economy, we've prevented people from earning a daily wage, people don't have money in their pockets, and they seem to be desperate. So, what do you do the one thing and you get a consequence. It's something different, right? So again, coming back to the urgent and important, it was urgent that we contain the spread of this virus. That's very urgent and important. But there's also the other important question as to how do we then look to protecting people who are very vulnerable. Many of us sitting in front of laptops like we are, in situations with a good internet connection, and we have got some arrangements by which we get our essentials supplied to us, may not know what fears and apprehensions and difficulties that Malati, that Indranil described, will have. What are we to do about that? Indranil, what are we to do about that?
Thanks, Professor Sudarshan, for actually setting the context well. So, and that is where probably the public policy approach and a public health approach can combine and think about. So, while one of the critical things the government could have done while planning for the lockdown is to think comprehensively and think the various dimensions of people's lives that could be affected. And one of the key aspect is the issues of livelihood. Now, while we are working in the nearby area, slums, and trying to provide some bit of relief to people, arranging some kind of resources, what we increasingly realize is that there are few key dimensions of access that or barriers of access that that are being faced by people at the most marginalized sections of the community. Key issue of water supply and sanitation, the issue of food availability. Though some governments are trying to expedite their rationing system, it's been too inadequate. And what could be done to change the situation? Now, the current context, the ration system depends on whether you have a ration card and which is linked to your Aadhaar. Many of the people dwelling in the slums either do not have ration cards or do not have other cards at all. So what do you do? Can we go back to alternative situations where we give priority to people's life rather than restricting ourselves to medical or technological solutions and depend on others and ration cards, or rather make food security as a public issue and ensure universal access to food as a priority? And also, other dimension, other key aspect is the issue of other livelihood security. As we know that the entire chain of supply, production, supply, distribution of many essential commodities are getting broken in the process of this lockdown. People have migrated, people who were doing some of the work in the urban areas we have already known how difficult it was for them to migrate back to their rural hinterlands, native places. But there was no choice, they had to go back. So even when the lockdown is closed, We need time for these people and amenities for these people to come back to their respective workplaces. It will take a lot of time. The agriculture sector has been affected by the lockdown quite significantly. We know that the supply chain of agriculture is getting affected, and things, vegetables, perishable commodities are getting rotten. The crisis would unfold. A public policy and a public health approach would have thought about all these dimensions while trying to implement the lockdown. Aspects
Pradeep,
of
you wanted
food,
to say
aspects
something?
of, yeah, please go ahead.
Yeah. So thanks to Indranil, Sudarshan. I'm also looking at a couple of questions. So Clinton Fernandez has squarely asked this question. So do you think the government did not plan the lockdown properly, or rather did not consider all the problems that might arise? So like a point blank answer is, it seems yes, that lockdown might have been required, but while implementing the lockdown, the government have failed to look at all the other aspects, different aspects that my colleagues talked about: livelihood, economy, agriculture, health, about that last person who we need to think about all the time whenever we are talking about public policy, about what is happening to that. So I think that whole explanation kind of answers to one of these questions, one of the question Clinton raised. And then there are a couple of other questions. Okay, Vivek has something to add on.
Yeah, go ahead, Pradeep. You finish. I'll take
No, what are the other questions? We can't see the questions, so you have to share them with us, Pradeep.
Yeah, so there are a couple of rather not questions but suggestions or comments. One couple of them by someone called Satpal Mimotra, who has said that so we have been active, we have been acting like these are all reactive actions and not proactive actions, because have we not learned from SARS or MERS, which has happened much before COVID-19? Which is again seems a very likely the case that we have, hopefully, as several of us are now talking, that this pandemic is hopefully going to help recreate our health system in a way that we are able to tackle such emergency or pandemic situation if it arises in the future, by strengthening the core of our health system, which is in abysmal form, given the kind of investment that we make and we have been making. Knee-jerk reaction doesn't work any day. Yeah, there were certain comments from Satpal. I'll keep on bringing in questions. Okay, in an interview with a local person, there's someone called Vanshaj who is asking, in an interview with a local person, they said that they are willing to die to a virus rather than starvation. How would the government tackle this mindset of people if someone wants to take this?
No,
Again,
okay.
there's a government failure.
Yeah, no, well, I think when Vivek described, public policy, or I don't know if it was you, what government does and does not do.
Does not, right?
Yeah. Very often when we study things, we study actions, and we say, was this action useful, effective, timely, successful, and so on. And when it's a question of not acting in action, that doesn't get so much attention. One of the things we emphasize in our understanding of public policy and how we educate students is to pay attention to that. That things are brought on the agenda for decision making. But one of the ways in which powerful people exercise their power is by making sure that something that needs attention from the point of view of the public welfare or public good doesn't come onto the policy making agenda, right? That something else is allowed to take priority over that. And we need to be able to understand the context in which it happens. In other words, public policy always benefits a group of people and will affect a certain people adversely. And they are generally spoilers. They don't want to do that. And there are people who prefer the status quo, not to change things. And public policy is all about bringing about change. And for some people, change is not desirable. So one of the things we can learn to sensitize ourselves in the study of public policy is to understand for any given policy, who are likely to be its champions and supporters, and who are likely to be the spoilers, who try to prevent that policy from being effective. Now, in the context, we can discuss whether we took timely action. First, for one thing, I think the world is generally agreed that President Trump did not take timely action, and now is blaming the WHO, unfortunately, saying that they did not raise the red flag. Had they done it, I'd have acted fast. And since they didn't warn me in time, I'm going to penalize them. Now, that's what he said. Now we can argue whether it's right or wrong, but we can ask the same questions of ourselves. Kerala was taking some action long before when Mr. Trump, in fact, showed up in India. Seized with that visit, it seemed to our policymakers that it's very important to have good relations with a very powerful country and a big economy on which our economic success to a large extent depends, trade and all of that. So in the terms of prioritizing, at one point we prioritized the visit of Donald Trump. It could well be that someone more sensitive to the potential danger and with some historical knowledge of what could happen with viruses of this kind, Mr. Trump should have called off his visit, or we should have called off his visit. Now, that's water under the bridge. It's past. We can take a view on it. We can learn some lessons from this experience and see what we should be doing in the future, where some lessons are drawn. So I'd like to look at what are lessons that are to be drawn now. One important lesson, it seems to me, is that we really don't know how many people are actually needy in this country. We've got people covered under certain schemes, ration cards, Manrega, and so on. But we've also got a large number of people who are fallen between these cracks, who are not covered by any welfare program at all. We know now that they are there, and because we're trying to figure out how to reach them, to be able to give them some food, some basic necessities. And so this is a lesson that our welfare system is not comprehensive enough. Our public health system is not comprehensive enough. It does not give universal access, and it raises important future questions. Should we have a policy where we give everybody a universal basic income? Something that whether you're rich or poor doesn't matter, because it's difficult to select and identify and administratively burdensome. We'll say everybody is entitled to rations. Only those who need it will go and get it. It is somewhat self-selecting, like the employment guarantee program of Manrega. Should we have something universal like that? Universal basic income, universal health access. These are some of the lessons that we need to draw from the current experience, which will inform public policy in the future. So I'd like each of our panelists to have some reflections on going forward, hoping that this virus will be behind us. It will never disappear, but it will not be virulent and potent and life-threatening for some time yet, until it comes in another form. At that point, what should be our policy priorities? Let's start with you, Indranil, and then Vivek, and then Pradeep.
I think a lot of thanks, Professor Sudarshan, but you have already pointed out the contours that we need to underline, that we need to think through. And also in terms of learning from our experiences, what is needed, I'll focus on few aspects on public health, what needs to be done, and then few aspects of economic system. So one of the key things in public health is to learn to have, the emergency response needs a lot of preparedness. So you need a stronger health system. And what do we mean by a stronger health system? the key element, the backbone of health system are the people, the human resources who are delivering services. As we hear that there are no protective equipments that the health workers have today now. They need better training. We have huge vacancies of doctors, nurses, paramedicals in public health system in our country. We need to strengthen the public health system. We need to also, other crucial thing is in the health system is to be able to produce medicines, equipments within public system, within the country. I think we are facing a lot of crises of protective equipments, medicines at this juncture, because our public sector units producing this are not equipped at this moment. Though India is the hub of cheap generic medicine of the world, but that is largely taken over in the private sector. So we need to create systems where we can respond to emergencies. In terms of economic aspects, I think the cost of not universalizing public distribution system has been coming out very vividly. People are hungry for last 20 days. Many households do not have adequate food, and these numbers are not small. We have around 40% of population who are in need of perpetual support of food security. So we need to universalize, expedite those aspects. There is a provision under National Rural Employment Guarantee Act that we transfer unemployment benefits to people, but also probably this is the time where we need to bring employment guarantee to urban areas. We need to think about what a lot of failures happen because we are caught up in the digital IT enabled systems and not being able to come out of these in terms of crisis. So we have to think about alternative ways of providing relief, water, sanitation, food, and public health. So this is a time to rethink. And also I would say, like Professor Sudarshan has already pointed out, politics becomes very crucial. So India is one of the countries which has very little tax resources generated overall. So we need to have better taxation so that we can deliver some of the key aspects of human life better universally. Thank you.
Vivek?
I think if I relate this to our MA in Public Policy course for a moment, see what the course is all about is that how can we make public policy better, so that our societal well-being increases as a whole. Suppose now, if you look at this particular government's response to the COVID pandemic, whether it is comprehensive, whether it is effective, whether it is efficient, how could the government could have done something differently? So that's the question which is amongst our minds, right? So this is the learning process for us who are engaged with policy, as well as for the government who is involved in making and implementing policies also. So what the course does is that towards this, it looks at what are the various theories, the principles that we have in understanding these kinds of policy responses, and how can we learn or get a good grasp of these principles so that we can use these principles to address the real world problems. Just to give an example, when we started this webinar, I laid out a 4-point framework which determines whether a public policy will be effective or not. One is how unprecedented the problem is. Has this problem occurred before or not, number one. And number two is how emergency the situation is. What are the implications if the action is delayed, in terms of lives like that. And number three is that how intensive it is on the part of the citizens to get involved in this for the policy to be successful. And number four is how intensive it will be on our administrative machinery, the public administrative machinery. Now, I would like to leave you with a question, keeping these 4 frameworks that we have, or keeping these 4 dimensions that we have, and the discussions that we had so far for the last 30 minutes or so, do you think ex ante, that is before implementing the policy, if we had similar framework to assess, could the government response could have been better? So this is the question I would love to leave with you, and we would like to have your answers on that. So please think, as we rightly say in public policy, there is no right answer, there is no wrong answer. Everything is contextual. So given the context, how do you think the government could have acted better, given these 4 dimensions of a policy of this nature? That's one thing I would like to launch with you. And I think as we go through this pandemic, I wouldn't say that all is doom and gloom. One important outcome of this pandemic that we are seeing, especially which is very dear to me as a medical doctor, is that this pandemic is going to improve our public health habits tremendously. I think this is a paradigm moment in which we change how we change our public health habits. To give you just one example, the governments in northern India, especially the government of Delhi, is thinking of bringing in a legislation which prevents people from spitting on the road. Now, I think those of you who are from Delhi or from north of India, you can see the pan stains all over. So it is not just an aesthetic problem, it's a big public health problem because that spit can transmit diseases. For the moment, it might be COVID-19, but if you look back, it is TB, right? Now, if all the governments were able to bring out a legislation like that and implement it effectively, I see it as a huge public health benefit, right? And also many times, in one of the public health challenges that we face are about hygienic habits. And I can see with some bit of assurance that people's attitude towards hand washing, which is one important source of getting disease, I'm sure it'll change in a way which we could never have changed with any policies. So I think that when we look at this kind of a scenario, we also need to look at what are the positive outcomes from a public policy response and what is it that we can learn. So Pradeep?
I'll just wrap it up very quickly, and I'll emphasize on the aspect that this course is all about helping you prepare to look into any aspect of emergency and or importance in a very holistic manner. When I say holistic, there are different dimensions to our living in a particular society or in a community, and how do different aspects come together, or why do we need to think about all those different aspects in our living, day-to-day living. This course is all about helping you to prepare, understand, unfold, untangle, and in a way kind of converge all those different aspects into one single theme while thinking about bringing an effective and efficient policy. Let me take one more sentence to talk about where do you or where can you find yourself being employed. That might be one very key question to several of you at this stage. So typically, like post your master's degree in public policy, you can find employment with international agencies, the UN organizations, which typically look forward to public policy graduates. You can find yourself being employed or working with government, be it central government, state government, local government, because your trainings typically brings in a holistic aspect, looking into the holistic aspect of a problem, which the present day government kind of typically fails to look into that way. There is a lot of private sector employment. The Facebooks, the Amazons, they do have public policy units where you can find yourself being employed. There are think tanks, research institutes, academia, of course. And then there is a larger non-governmental sector where you can find yourself being employed. You can create your own employment. There have been a few cases where our graduates have they have developed their own employment source. There can be fellowships which you can find yourself being employed for a certain number of years. So these are a couple of avenues, sectors where you can find employment. I can either let Hemant talk a little bit, or I can talk. I think
we are coming to the end of the.
Yeah, and there are few questions which several of them have asked. If
let's deal with those.
The panel. Okay. There's someone who has asked a question like, in a country like India, we have a huge population. So do you think that the government can make decisions regarding all the citizens of our country in such an emergency situation? Is a question coming from someone, I believe. I do not know the name.
Then
How did policy in countries like South Korea, Singapore, and Japan handle COVID well? Is one question. Another question coming from Tanzil is, how can public policy be contributing in the economy after the lockdown is brought down, and how can it provide equity? So I think some of these aspects of questions most of us have already discussed during our conversation. How do India's policies match up against Canadian ones with regard to this pandemic? We have not specifically talked about the Canadian aspect, so if one of us can want to take that. In this situation, how can the government take decisions regarding economic conditions as well as the welfare of citizens of our country? A similar question coming up.
Okay.
Yeah, I think
let me try and tackle them in the little time we have, if that's all right.
Yeah, absolutely.
There is one critical question which I want to flag, and then we can all take up answers to answer. Public policy is to bring change, correct? So do behavior change happen overnight? Sometimes probably yes. Prime Minister calling for lockdown and then we are all locked down. So certain behavior changes can happen overnight, but for most other things it certainly takes time. Habit formation takes time of citizens. It's a question. PM is fighting for cleanliness drive. Why policy is motivated by political ideology? Isn't health kept above all of this? So
yeah,
begin with
these
yes.
are all excellent questions, and who asks these questions is eminently qualified to join a program in public policy and think critically about the answers, because there's no one definite answer to these questions. What I say is that one of the elements in our studies that we emphasize is some comparative understanding. When we look at public policy issues, it's a very good idea to look at what other countries have done. Now, for instance, it's been reported that in the United States, the number of deaths of Black Americans is disproportionately high to the proportion of the population that they have. That's not the case in Canada. Now, why? Now, it's worth thinking about that. Now, that's because Canada as a country has explicitly acknowledged that multiculturalism is an important feature of its politics and its policies. And therefore, the Canadian government has, with respect to the First Nation people, the Indigenous peoples of Canada, as well as the minorities in Canada, of which the Sikhs are a very large part, they've made and taken steps to include them in the mainstream. So it is not just a white Canadian ex-British colony that dominates. And so you can see in the context of an epidemic of this kind and victims, death victims of COVID-19, there's a big difference between Canada and the United States. And there's a lesson in that for us, because we are a highly segmented society. We are a society that in our constitution, we are professing inclusiveness and multiculturalism. But in actual practice, in every locality, we have to examine whether the constitutional values have been transmitted. And the challenge is how to transmit those constitutional values. It's true that habits change, and habits can take a long time to change. And one of the habits, unfortunately, of a segmented society that's still taking a long time to change is this business of not mixing with other people, to have marriages within a particular kin group, so therefore, in a way, ironically, being locked down and closed off from other people hasn't seemed to be such a strain in this country as it might seem in a more individualistic society, where the only other human contact you have are people who you're working with. We are very closed in with particular communities, and our connections with other communities have been limited. And so these are lessons that we have to learn, that other communities and what happens to them matters to us. this realization will come because of this experience, that you cannot say, oh, those are people are beyond the pale, I don't have to worry about them. You have to care and worry about every human being, because if any one human being is in danger in a situation like this, everybody is in danger. So these are good questions. Comparative knowledge, historical knowledge, as Vivek has emphasized. Do we know, have we any experience of dealing with such things in the past? Is it something that's very new and is the first time we have to tackle? These are important questions. But on the whole, I'd say that, you know, I mentioned earlier that it's important to be, to have a sensibility to the culture of people. And I think in that respect, the Prime Minister of India has been a great communicator. The fact that he asked people to light a lamp, you know, and this is something we traditionally do. It doesn't matter, Aligarh Muslim University, Jamia Millia University, any university, when it has an event, traditionally as a customary and cultural practice will light a lamp. And in this country, lighting a lamp means dispelling ignorance, dispelling danger. You know, it is, you know, tamasoma jyotirgamaya. This is well known, and to ask people to do that is a way of creating a certain solidarity. The other analogy that he used, which is a little doubtful now, he said the Mahabharata war took 18 days to end, and he will hopes that this one will end in 21 days, but it hasn't. But it's interesting that he referred to the Mahabharata, because it again poses some very important public policy questions. So if some of you need to think about it. In the Mahabharata, Arjuna begins by saying he's not going to fight, because the consequences of fighting will be death, and everyone would more or less be dead. So what's the point? The consequences would be so terrible that it's not, he should not do that. And Krishna kind of persuades him with, you know, the Vishwarupa and awe and whatever, to say that he must do his duty. He must do what is right by who he is, and not to worry too much about the consequences, right? So these are sorts of questions that we have to tackle in public policy. You know, the Prime Minister knows calling a lockdown is going to shut down the economy and cause great hardship. Is this the right thing to do? Is it the good thing to do? What will be the consequences? Is it right? Is it good? Now, these are dilemmas. There are ethical dilemmas when you make policies, and it's important to figure out what kind of stance you may take. You may take the view that this was, you know, 4 hours notice to lock down an entire country was unfair. On the other hand, you could take the view that, you know, 5 hours could have caused a few more deaths that could have been avoidable. So these are ethical issues that we will have to debate and discuss. And one of the nice things about a program in public policy is that we hone our ability to make some practical judgments. You know, we are all human beings. We are not infallible. We will make mistakes. But nonetheless, knowingly, you know, to make decisions, you know, is important. To make judgment and to base that judgment on facts, evidence, what is known to the best of our ability, and then make the decision is important. That's why we keep talking about evidence-based policy. And we are critical of government and government departments very often, because we think that in their case, it is they manipulate the evidence to show that the policy is working. That's why administrative data in our country is not trusted as much as the NSS and the CSO data or the census data, because for administrative departments, they want to put a rosy picture on what they do. And so what kind of data to rely on, how to make sense of what the data tells you, how to evaluate a project, whether it's succeeded or not succeeded. These are all things that is a vast ocean of knowledge which can be learned, and it's of course a matter of lifelong learning, I'd say.
And to sum up this aspect, our public policy program typically integrates all these aspects of apart from different domains, the data part, which Dean Sudarshan mentioned, in a very big way in most of our courses. And so we emphasize both on the qualitative side of the study as well as the quantitative side of the study. So there are a lot of
Hemant, last
courses
word
which
to you.
you will.
Yeah, you've got some of the students listen to this webinar have been in conversation with you. I would like you to continue the conversation to get some feedback on whether they found listening, spending an hour and a bit on a webinar like this is useful, whether they would like us to do more of these, address different topics, more questions can be answered. So to get feedback, as I said, the important thing in public policy is to get feedback. So we thought this policy of communicating in these difficult times in this way is useful, and the students would find it useful. But we will only know that if we get feedback. Yeah. Okay.
Sure. As I can see, many students have already started sending SMS to me. Started about the question and various questions, which in case if I think I have to revert back, I will definitely come back to you. And
Okay.
I hope all the students who have joined this session would be definitely beneficial and will help them in a manner to take the final decision for joining this course. Right. Thank you very much.
All right.
Thank you, Professor. Thank you, Dean. Thank you very much.
Thank you very much. Thanks to everybody.
Thank you.
Yeah, that was an interesting conversation, at least for me. I would say that the next time we have questions visible to all of us. We had to spend a little time asking Pradeep to narrate questions. If the questions become visible to all of us, some of us may spontaneously pick up and answer them and save time. Okay.
Certainly. Right. Thank you very much. Have a nice day and take care. Bye.
And stay safe.